Hello, I hope you're doing well. Today we're going to share about cleft lip and palate. Yeah, that's a birth defect. There are very many birth defects, and cleft lip and palate is one of them. So that's what we're going to share about today. And basically, we shall look at the types. Yes, we shall look at the treatment, the complications. In our talk of today, we shall look at a couple of things. Of course, we have to define it. We need to define the cleft lip and palate so that we can get to know about it better. We shall talk about uh, the risk factors, yes, for cleft lip, and we shall talk about the causes. So you really have to be very attentive in this discussion, and I know we are going to learn something very, very much important, because this happens so much in kids. Like I told you, it's a birth defect, and we shall also talk about the symptoms, the signs and symptoms, and basically I think that's it. What else shall we discuss? Yeah, other things will be coming up. The prevention measures, all that is going to be discussed here. So please pay some attention and you'll be blessed. All right. Uh, we are talking about a cleft lip and palate. First of all, you need to know what a cleft is. A cleft is a split. You can call it a divide. So when we talk about a cleft lip and palate, the cleft lips and palates, they do happen before birth, actually. Yes, they do happen before birth. So a baby can have a cleft lip. He can the baby can have a cleft lip, can have a cleft palate, or it can even have both. You get it? So a cleft lip may be on one or both sides of the upper lip. Yes, it can be on one side or even on both sides of the lip. That's a cleft lip. And the split may also be in the upper jaw and gum. Yeah, that's very possible. And let me talk about the cleft palate. For a cleft palate is an opening in the roof of the mouth. Once you see an opening in the roof of the mouth, so that's a cleft palate. The front part is the bony hard palate. The back part is the soft palate, and it's made of muscle. A cleft palate can be on one side or both sides of the mouth. Okay. Now, have you ever seen a baby with a cleft lip? That's a question for you. In case you have not seen, maybe you'll see someday, but these are common cases. You should probably have seen one or even more. A child can have a submucous or hidden cleft palate. This happens when tissue, that tissue, there's some tissue called the mucous membrane that covers the cleft. Are you getting me? And it is the pink tissue that you see in your mouth. The cleft may be hard to see, and you may not know even that it is there. Yes, that's true. So many times the cleft may be hard to see, and it may take you time. You may not even recognize that it's actually there, and yet it's there. So let me go and talk about the types of cleft lip. So the type of cleft lip and maybe and the palate, yes, taking them together. a child, that type, whichever type the child has, will determine the kind of care that he or she needs. You get it? So a cleft lip means that there is a gap in the baby's lip, and the cleft may be on one or both sides of the upper lip, and it may reach all the way to the nose. Yes, it can push up to the nose. Many times, oftenly, a baby with a cleft lip may have a gap in the upper gum. Yes. And the cleft palate has a gap in the roof of the mouth, and that connects to the nose. I hope you are getting this very, very well. Um, I was saying that a cleft palate has a gap in the roof of the mouth that connects to the nose. And the combination of a cleft lip with a cleft palate is more common than just a cleft lip or just a cleft palate. So that means that so many times you find these existing both at once. It's rare to find someone having only a cleft lip, or when someone has just a cleft palate. At most chances, you'll find somebody having both a cleft lip and palate. So there are risk factors for this. There are various factors which increase the risk of the child to develop cleft lip and palate, and these are the ones I want to talk about right now. And to start with, gender. Gender. When you talk about gender, men are at a double risk of developing a cleft lip, whether with or without a cleft palate. Uh, not that, please. That men are at a double risk, or they are even at a higher at a higher risk of developing a cleft lip. And for women, they are at a high risk of developing cleft palate without a cleft lip. You get it? And yes, that's a risk factor. So when we talk about gender being a risk factor, that is it. That's how it stands. And then the other risk factor is the family history. So for the family history, you see individuals who have a family history of a cleft and palate are at a high risk of developing it. The moment you have this in your family history, maybe somebody in your family has gotten such, you stand high chances of getting that. The other risk factor is smoking. And now the probability of cleft lip and palate increases if the mother uh, is smoking during pregnancy. If your mother is a good smoker, eh, you stood high chances of getting cleft lip and palate. If you don't have it, then you thank God. You're just very much lucky by God's grace. But if the mother is pregnant and she's smoking all the time, there are high chances of getting cleft lip and palate. Let's go to another risk factor, alcohol consumption. For those who are consuming alcohol and you're pregnant, those ladies, please, 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 consumption of alcohol during pregnancy increases the risk of developing cleft lip and palate in the child. So you're putting your child at a risk of getting cleft lip and palate. Please try your level best and leave alcohol when you are pregnant. If possible, leave it forever. So another risk factor is medications. Yeah, there are certain medications like steroids and anti-seizure medication. So these medications, if taken during pregnancy, they increase the risk of cleft lip and palate in children. Yes, some medications, like I just mentioned, the steroids and anti-seizure medications, they will do increase the risk of cleft lip and palate for the children. Okay. The other risk factor is diabetes. For those known cases of DM, diabetes mellitus. Once you have diabetes, children of women who have been diagnosed with diabetes before the pregnancy have a high risk of cleft lip and palate. Yes, not that. Then the other risk factor is obesity. If the woman or the mother is obese, so that puts the child at a high risk. Children born to obese women have a high risk of having a cleft lip and palate. Now, those are the risk factors, and there are very many others, but yeah, I'm just tapping a little bit. You go make further research. Allow me to go to the causes of cleft lip, and it happens when the structures that form the upper lip or palate fail to join together when a baby is developing in the womb. Yes, like I told you earlier, that just as we were starting, I told you very much properly and clearly that that defect even happens before the child is born. You get it? So it happens as early as before you're even born. So uh, that is something. It happens before birth. That's what I'm trying to mean. Okay. All right. So that's one of the reasons. Uh, I was saying that about when I was talking about the causes of cleft lip. Then I say that it happens when the structures that form the upper lip or palate fail to join together when a baby is developing in the womb. So it starts all the way when the baby is developing in the womb. That's when the structures that do form the upper lip or the palate. So once those structures fail to join together, yeah, then that develops. The defect starts to develop. And still about the causes of cleft lip, the exact reason why this doesn't happen in some babies is often unclear, and it's very likely to have been the result of anything you did or you didn't do during pregnancy. Yeah, most likely. And in a few cases, cleft lip and palate is associated with the genes. You see, the genes a child inherits from their parents. So the genes that you do inherit from your parents, it can also put you at a risk of that. It can be associated to to having the cleft lip and palate, although most cases are one off, just a one off. And then also cleft lip and palate can be associated with smoking during pregnancy or drinking alcohol during pregnancy. It can be associated. Those are all causes. So obesity during pregnancy. So please, women, you have to be very serious. Pregnant women, take great care. It can be associated. This cleft lip and palate can be associated with a lack of folic acid during pregnancy. It can be associated with taking certain medicines in early pregnancy, such as some I've already mentioned, the anti-seizure medications and and the steroid tablets. I've already mentioned something like that. And in some cases, a cleft lip or palate can occur as part of a condition that causes a wider range of birth defects. Yes. So uh, you have to be very, very much careful, my dear brother, my dear sister. For those who are in marriage and for those who, especially the ladies. Now, this goes to you so much, the ladies. Okay, let's go to the symptoms. Trying to be a little more faster. I want to be faster than that, but I still don't want to be so fast because I want you to really get this and you don't have to miss out. But still, we are time conscious. So let's talk about the cleft lip symptoms. And now the symptoms to watch for that would indicate a submucous cleft are here, and that's what I'm going to talk about now. Um, Firstly, nasally sounding speech due to air exiting through the nose. Yeah, there is that among the symptoms, there is nasally sounding speech due to air exiting through the nose. So once air is exiting through the nose, you even the speech when the person is talking, you see the speech will sound nasally. You get it? All right. And then the other symptom is feeding and swallowing problems. Yeah, still under the signs and symptoms. So you see a person will be having, or even if it's you, will have problems with swallowing and feeding, and including food and liquids entering the nose. You get it? The other, still among the symptoms, there is ear infections. You can experience ear infections caused by atypical muscle attachments. So ear infections can also come around. There can be a symptom of speech being affected by babies and children in multiple ways. So speech can be affected several ways, in a number of ways, in a couple of ways. So babies may be delayed in starting a bubble, uh, like to bubble becomes difficult. You see, babies may be delayed in starting to bubble while having a limited consonant range while bubbling. So bubbling becomes so hard, and you realize that the child has a limited consonant range, and these are all issues. These are all issues with speech. Speech becomes affected. You get it? So those are all signs and symptoms, and the baby might be delayed in uttering their first words. You see, the baby can be delayed in uttering their first words while learning additional words at a slower pace, and they really learn at a very, very much slow pace. You see, learning additional words at a very slow pace. You get it? So that's all among the signs and symptoms, and you realize that as the children age, they might be prone to articulation errors and a delay in expressive language abilities. So a child is experiencing errors in articulation. The child will have delays in expressive language. You see, they have a challenge in the ability to express or to use an expressive language. There's that challenge, you get it? And they may have what we call a soft voice syndrome. Okay? Please note all those things and take them very important as far as cleft lip and palate is concerned. And also, feeding challenges occur in babies as they can't separate the nasal and oral cavities. Yes, so feeding becomes a challenge to the babies because why? Because they cannot separate the nasal and the oral cavities. And what does this bring about? It prevents them from sucking while affecting their ability to, to express breast milk from the nipple. So it really becomes so hard and a big challenge because you see they cannot suck or they cannot suckle. You see, it affects their ability to express breast milk from the nipple, so they cannot even breastfeeding becomes hard for them. They cannot really do it effectively, and yes, inadequate nutrition may lead to poor weight gain. Of course, that is now on the side of nutrition. Once they cannot breastfeed very well, they cannot suck, they cannot feed on that milk, they cannot suckle properly, so they cannot breastfeed, meaning there will be inadequate nutrition. And now, inadequate nutrition, what will that show? Will it how will it be exhibited? We shall see poor weight gain. That is a sign. And the child might take in too much air and experience fatigue as a result of working so hard to feed. So the child will be struggling and working so hard to feed. And what comes from that? The child will take in too much air. And as a result of that, they will experience fatigue. So fatigue, those are all symptoms for cleft lip and palate. And yes, I guess I already mentioned the ear infections. And in addition to the ear infections, conductive hearing loss is possible. Yeah, that's another symptom. So conductive hearing loss is possible. It's been noted that over 90% of the children with a cleft palate will suffer from middle ear fluid buildup. Let me repeat this. It has been observed and noted that over 90% of children with a cleft palate suffer from middle ear fluid buildup. That was very clear, I guess. And uh, hearing loss may also cause socialization issues in older children. Why? Because there is an inability to keep up with conversations. Of course, when somebody cannot hear very well, uh, of course, that is it results into social issues. You see, somebody will not be comfortable associating with others, and socialization becomes really so hard, especially for the older children, those that have grown up. And that is because they can't really effectively keep up with the conversation. They don't fit in society. They feel like they don't fit in society. They feel like they're not even worth living among their colleagues. And now, allow me to, as I'm just about to finish, allow me to talk about the complications of cleft lip and palate. Uh, you should know that children with cleft lip, with or even without cleft palate, they face a variety of challenges, and this depends on the type and the severity of the cleft. You get it? To start with, there is difficulty feeding. That is a complication. Difficulty in feeding, and this is one of the most immediate concerns after birth. It is feeding. It is a serious concern after birth. Feeding is very, very important, and now it becomes a concern when the child has cleft lip and palate. And while you see, most babies with cleft lip and with cleft lip can actually breastfeed. But in the case of a cleft palate, it becomes difficult to suck or to breastfeed or to suck, and to take in milk, to breastfeed, to suck, whatever you call it. It becomes really hard when there is a cleft palate. And then the other complication is ear infections and hearing loss. Most of these things I've talked about already. So babies with cleft palate are especially at a risk of developing middle ear fluid and hearing loss. So in that case of the middle ear fluid, of course, you see it's something to do with the otitis media. So you'll need to read more about that and get to learn more there. And hearing loss, that impairment, hearing impairment. The other complication, you see, dental problems can arise. For example, if the cleft extends through the upper gum, just imagine that. If the cleft extends through the upper gum, tooth development may be affected. So that really becomes a serious complication. The tooth cannot develop effectively. So there is that effect, and it's a complication. Dental problems is the point under the complications of cleft lip and palate. Then the other complication is speech difficulties, because the palate is used in forming sounds. Yes, that is something you have to note. The palate is used in forming sounds. The development of normal speech can be affected by a cleft palate, and speech may sound too nasal. You feel like somebody's talking through the nose. So it's really funny, but that's the truth. And so speech difficulties, there are difficulties with speech. Somebody sounds nasally, so That's a complication. And the other complication is that there are challenges of coping with the medical condition, and uh, when we talk about the challenges of coping with the medical complication, for the children with clefts may face social, they may face emotional and also behavioral problems due to differences in appearance and the stress of intensive medical care. So that really becomes a serious complication and a very big challenge. So it becomes hard to cope with medical condition. Just imagine you have that cleft, and you feel like you don't fit in society. There's that torture, emotional torture, psychological torture. You face those behavioral problems. You feel that social distance even when it's not there. You feel, oh my god. I know you can try to understand this. And how do we diagnose this? Let's go to the diagnosis. Of course, there are no special tests required to diagnose, as the cleft palate is noticed at birth. Yes, like I told you earlier, this can be noticed at birth. But in order to determine the condition before birth, doctors may conduct a prenatal ultrasound at the beginning of the 13th week of pregnancy. Yes, so the doctors can conduct that prenatal ultrasound, and note that this is supposed to be done at the beginning of the 13th week of pregnancy. So you have to be very calculative in that time of pregnancy. So if a cleft is diagnosed, the doctor may ask the mother to undergo a test where, and in that test, a sample of the amniotic fluid from the uterus is taken. So this test will determine if the fetus has inherited genetic syndrome. Did you get that? That test which is done, it will determine if the fetus has inherited genetic syndrome. And for the ultrasound, um, of course, that's the ultrasound that is done, and it's done at the beginning of the 13th week of pregnancy. Yes, so basically that's what can be done. And allow me to talk about the treatment of the cleft lip. And the cleft lip and palate is treated with the aim to enhance the physical appearance and to improve the eating, speaking, and hearing ability of the individual. I think I have to repeat this. When the cleft lip and palate is being treated, there's an aim. And what's the aim? The aim is to enhance the physical appearance and to improve the eating, speaking, and hearing ability of the individual. And now, what are the approaches that are used for treating cleft lip and palate? Here we start. Feeding support. Once we are treating cleft lip and palate, we want to support feeding. So during breastfeeding, infants with cleft lip and palate have to face many difficulties, you know that. So the mother has to feed in a certain specific position or use a specially designed bottle for feeding. So that really becomes challenging. And the other approach, of course, now I'm talking about the approaches. First of all, I talked about the feeding support. Then there is hearing support and under hearing support. Infants born with cleft lip and palate have a high probability of dull hearing. I already talked about that. And the dull hearing is due to the presence of glue-like solution in the middle ear rather than air. The middle ear, there's supposed to be air, but now when there is glue-like solution in the middle ear, so that brings about issues with hearing. There is dull hearing, call it hearing loss. And if the infant has a dull hearing, Uh, Tiny tubes are used to remove the fluid. All hearing aids are fitted to improve the hearing ability. So that's the approach. That's what we do in the as we are trying to offer hearing support to the infant. Now the other approach is dental treatment, and like I told you earlier, you see, dental problems arise as a result of cleft lip and palate, and now the parents or the caretakers are taught about dental hygiene. And if the child does not develop teeth properly, the physician will recommend braces. You get it? So that was very clear. Once we see or notice dental issues, dental problems, those caretakers of the child or the infant, it could the caretakers, the parents, they are taught about dental hygiene and brushing the teeth um, every after meals, it's and after the dental hygiene and also after the dental hygiene, after teaching them about dental hygiene, in case the child does not develop teeth properly, we know, if we notice that the teeth are not developing well, they're not well aligned, they're not, they are getting complicated, so the physician will recommend braces. So braces can be of help. They can help align the teeth in the right way, the dental formula gets well set. Okay. And now the other approach under the treatment and management of the cleft lip and palate is the speech and language therapy. What happens here? You see, infants born with cleft palate face difficulties in speaking. Yes, and a speech and language therapist monitors the development of language and speech during the entire childhood, and he also gives suggestions accordingly. Um, Sometimes, yes, surgeries are done to correct the cleft lip and palate. So, the surgery to fix the cleft lip is done within 12 months after birth. The surgery to repair cleft palate is done within 18 months after birth. Follow-up surgeries are done in childhood and adolescence if required. I still want to talk more about the surgery in under the management and the treatment of cleft lip and palate. So the treatment um, called nasal alveolar molding, NAM, you can call it NAM. So this treatment, still under surgery, this treatment called nasoalveolar molding aims to prepare the infant for future surgery. And surgery to close the cleft lip may be happening, or it may take place within 3 to 6 months of birth. An infant will generally receive treatment for a cleft palate between the ages of 9 and 18 months, and this could uh, it actually should enable the child to speak and eat without further difficulties. So you realize that the child will start to feed and to speak easily without any challenges, without any difficulties. And before um, oh God, I think just about to stop. We're just about to stop. I hope you really have learned. You really it was the lecture is getting so long, but we are just about to finish. You don't have to worry. Um, um, so corrective surgery can help realign the jaw. Yeah, there are times when the jaw is not well aligned, so corrective surgery can help realign the jaw. In cases where a child needs surgery to correct the jaw, Some doctors prefer to wait until the child reaches the ages of 10 to 12 years before performing the surgery. And waiting for all adult teeth to develop before the surgery may prevent the need for corrective surgeries further down the line. And so you have really to be very careful and sensitive as far as this is concerned. Okay. Yes. Um, um, of course, while um, briefly, I should say something about the prognosis for cleft lip and palate. Okay, so while the effective treatment for cleft lip and palate requires many surgical procedures, speech therapy, and consultation with many medical specialists, it should be it actually should be anticipated that an excellent outcome regarding appearance and function can be achieved. Yes, in order to maximize the medical management as well as coordination with multiple healthcare professionals and parents, a cleft palate team is generally the preferred approach to coordination of care. So such teams are commonly found at pediatric teaching hospitals as major in those major cities. And the members of the medical team will commonly consist of people like the plastic surgeon, still on the among the members of the medical team, they could consist of an otolaryngologist. Yeah? That is somebody to do with ear, nose, and throat, ENT. That's an ENT doctor. You get it? We call him an otolaryngologist. So, still on the medical team, there could be an oral surgeon. There is to be a prosthodontist. Those are the specialists that make dental appliances. We call them prosthodontists. And on the team, on the medical team, there could be a dentist or a dentist and the orthodontist. There could be a speech pathologist, call maybe a therapist. On the team, medical team, there could be an audiologist. An audiologist is a hearing specialist. That person specializes in hearing. Still on the medical team, there is to be a social worker. That social worker, maybe you can call him a psychologist. Still on the medical team, there is a genetist. There could be also a nurse coordinator. So basically, that's those are the people that can make up the medical team that handles this. Okay. Now, you'll allow me to stop with prevention, how we really can prevent this, uh, because time is running so fast. So the exact cause of these birth defects is unknown. That is, to be honest. So you cannot prevent or avoid them, but there are steps you can actually take to lower your risk of having a baby with a birth defect. And these are the steps that I want to share with you today. And to start with, you can take folic acid before and during pregnancy. This goes to the women, basically, especially the pregnant women. So you can take folic acid before and during pregnancy. Note that. Secondly, avoid tobacco, avoid drugs, avoid alcohol during pregnancy. Avoid all those things during pregnancy. Those drugs, the tobacco, the alcohol, as long as you're pregnant, avoid all that. Then, the other way of preventing cleft lip and palate is getting to a healthy weight, before pregnancy and not gaining too much weight during pregnancy. Make sure you get to that healthy weight, get to that really nice weight before you become pregnant, and do not allow to gain too much weight during pregnancy. It's healthy to do exercises, so make it a point that you can always do physical exercises. Okay. And then the other way of preventing is getting vaccinations and protecting you from infections. So vaccination is very important. Take it serious. Get vaccinated, and that will protect you from infections. And lastly, talk to your doctor about these and other ways to help reduce the chance of birth defects. Like I told you earlier, the cleft lip and palate is a birth defect, but it's not the only birth defect. There are also very many other birth defects, but as a measure of preventing all these, you've got to talk to your doctor about these things, and also talk to him about other ways to help you reduce the chance of birth defects. I want to say thank you for your attention. I hope you have learned something, and see you next time. Good time.